my name is Haley Bryan, and I would like to speak with you all for a few moments about dysautonomia awareness. I want to show you an umbrella. Now I would like to ask you a question. How many of you have heard of an illness called dysautonomia? Dysautonomia is an umbrella name for several illnesses of the autonomic nervous system. Now I want to ask you another question. How many of you have heard of an illness called POTS? POTS stands for postural orthostatic tachycardia syndrome, and it is one of the illnesses under the umbrella of dysautonomia. Another illness under this umbrella is chronic orthostatic intolerance. According to Dr. Jeffrey R. Boris with the Children's Hospital of Philadelphia, these two illnesses have been referred to as invisible illnesses, although they are estimated to affect at least 500,000 people in the United States alone. They are more dominant in females, with the onset usually being in the early teen years. In an article by Nature Reviews Neurology, they are referred to as invisible illnesses because they stem from the autonomic nervous system. This part of the nervous system is responsible for what your body does autonomically. This means that your body does it without your thought or control. It's involuntary. For example, breathing is an autonomic process. Your heart beating is also an autonomic process. You do not tell yourself to breathe, and you do not tell your heart to beat. Your heart beats because that is the way the body works. It's an involuntary process. So what happens when a person struggles with a disorder of this system? Whether it's POTS or chronic orthostatic intolerance, these illnesses can baffle physicians because they cannot see the autonomic nervous system, and that makes treating this part of the nervous system quite difficult. Postural orthostatic tachycardia syndrome and chronic orthostatic intolerance, which we will refer to as dysautonomia, are widely misunderstood in the medical field. As a result, many physicians vary between not knowing how to treat them to not accepting them as real because they cannot see them. Doctors from the Medical College of Ohio have noted that cases of this have been traced back to the Civil War time period. At the time, these were referred to as irritable heart syndrome or soldier's heart because they were frequently seen in soldiers. The name would change many times through the years, but will all fall under the term of dysautonomia today. Common symptoms of dysautonomia are as follows: dizziness, tachycardia, syncope or fainting, difficulty concentrating, also known as brain fog, exercise intolerance, and extreme fatigue. Other common symptoms of this disorder are cool extremities, heat intolerance, pooling of blood, gastric problems, headaches, and more. These symptoms can be debilitating. Many people have a marked change in orthostatic intolerance, usually related to postural change or exertion. When a person without dysautonomia stands or moves to an upright position, his or her blood pressure drops and their heart rate rises to bring the blood pressure back into correct alignment. This is autonomic. It happens involuntarily. However, for a person with dysautonomia, when they move to an upright position, his or her blood pressure and or heart rate may not respond correctly. This will cause a rapid drop in blood pressure that may lead to syncope or fainting. Some will also have tachycardia as the heart beats faster than normal to compensate for the decreased blood pressure. The frustrating part of this is that individuals never know when this disconnect in their autonomic nervous system will happen. They cannot control it because it's an autonomic process. This is the reality for those who suffer with dysautonomia. So what can be done? A tilt table test is a diagnostic tool used to help diagnose dysautonomia today. The tilt table test helps to determine how the blood pressure and heart rate will react when the body is elevated. Patients may also undergo an MRI, blood test, and neurological testing before a diagnosis is made. Once a diagnosis is made, treatment recommendations will be made. Treatment recommendations may include the following: a high salt intake, small yet frequent meals, exercise, an elevated head when sleeping, and increased water intake. Depending on the patient and the severity of the case, medication may also be recommended to help regulate the individual's blood pressure and or heart rate. Additional recommendations may also be made. According to doctors Ahmed and Lila Jarjor from Texas Children's Hospital and Baylor College of Medicine, low ferritin, blood pooling in the legs and stomach, and underlying autoimmune diseases and other physical conditions have also been contributing factors that may need a doctor's attention. If a person follows their treatment plan, they can improve. However, at this time, there is no known cure for dysautonomia. Dr. Jeffrey R. Boris with the Children's Hospital of Philadelphia said that frequently providers are not familiar with either the evaluation or the management of this syndrome. There is a need for ongoing research. There is also a need for ongoing education of people. There needs to be awareness brought to dysautonomia. October is Dysautonomia Awareness Month, and turquoise ribbons are used to represent and bring awareness to this disorder. If you or someone you know or love suffers from dysautonomia, please know that there is hope and help. Thank you for your time and attention.